How reliable is amylase for diagnosing pancreatitis? Imagine trying to solve a mystery with a tool that might sometimes give you clues, but not always the full picture. That's what diagnosing pancreatitis has been like with amylase testing. In the past, doctors relied heavily on measuring serum amylase levels to confirm if someone had acute pancreatitis, which is a sudden inflammation of the pancreas. Amylase is an enzyme produced mainly by the pancreas and salivary glands, and when the pancreas gets inflamed, it can leak into the bloodstream, causing blood levels to rise. So, a high amylase level seemed like a clear sign of pancreatitis. But medical experts now agree that relying solely on amylase isn't very reliable. The sensitivity of the test, which is how good it is at catching true cases, ranges from about 45 to 87%. That means it can miss more than half of actual cases, especially if testing is delayed. Its specificity, or how well it rules out other conditions, is better, usually between 90 to 99%, but false positives still happen. Conditions like salivary gland infections, kidney failure, or other abdominal issues can also cause elevated amylase, leading to confusion. Plus, in some cases of pancreatitis, especially if the patient comes in late or if the cause is alcohol-related, amylase levels might be normal. Another important point is that amylase levels spike quickly after symptoms start, often within hours, but they also return to normal within 3 to 5 days. So if someone delays seeking medical help, the test might not show elevated levels, even if pancreatitis is present. Because of these limitations, the medical community now prefers to use serum lipase, another pancreatic enzyme, which stays elevated longer and is more sensitive. Lipase levels tend to be more consistent and less affected by other conditions like high blood fats, which can interfere with amylase tests. Guidelines from major health authorities recommend using lipase as the primary test when diagnosing acute pancreatitis. Testing both enzymes usually doesn't add much benefit and just increases costs. It's also important to understand that neither amylase nor lipase is useful for diagnosing pancreatic cancer or assessing the severity of pancreatitis over time. In chronic pancreatitis, enzyme levels can be low because of long-term damage, but this isn't enough for a diagnosis on its own. So, to sum up, amylase testing played a key role in the past, but today it's clear that it's not a reliable standalone test for pancreatitis. Lipase has taken its place because it provides a more accurate and longer-lasting indication of pancreatic inflammation. If you're worried about pancreatic health, remember that diagnosis involves a combination of clinical evaluation, blood tests, and imaging studies. Always consult a healthcare professional for personalized advice. Understanding these differences can help you make informed decisions and ensure you get the right care when needed.